Hello and welcome. I am Dina Boyle, Executive Director of St. Mary's Foundation, and I am joined today by Kyle Nondorf, St. Mary's Hospital President. Thank you for joining us for our first ever virtual event honoring healthcare heroes. It is our custom at SSM Health to begin with a reflection. However, today we have a very special musical reflection planned a little later in the program, so please stay tuned. You won't want to miss it. Before I turn it over to Kyle, I would like to offer a special thank you to our event sponsors, Buye Law Office, EUA, Gordon Flesch, and Marquette Associates. We are so grateful for your generosity. You are among the philanthropic heroes we celebrate today as we invite all to join us in support of St. Mary's healing mission.
Thanks, Dina. As St. Mary's Hospital President, I would like to thank our exceptional providers and employees, our dedicated volunteers, and our generous philanthropic partners. You are our healthcare heroes. We are grateful for all in the Madison community for opening your hearts and offering support as we respond to the COVID-19 pandemic. Here at St. Mary's, we've made significant operational changes to ensure the safe delivery of high-quality, mission-driven care that you expect from St. Mary's. From life-threatening emergencies to welcoming new babies, before, during, and after the COVID-19 pandemic, St. Mary's is here to serve.
That's right, Kyle. And through philanthropy, St. Mary's Foundation is proud to help our healthcare heroes save lives and provide hope. And this first story is an example of just that. Let's watch Jody's story.
My name is Jody Kowalski. I live in Madison with my husband. We've been married for 24 years and have raised two incredible children, Hunter and Haley, who are now both attending college.
Being empty nesters is a new normal for us. Scott and I enjoy a healthy lifestyle. We exercise, we eat right, and we have our annual exams with our primary care providers. Good health is not taken for granted. We work at it daily.
In my professional career, I was a teacher at the Madison and Middleton Cross Plains Area School District. I left teaching to be a caregiver for my mother. On November 12, 2019, my husband Scott and I went to the Princeton Club to work out. It was as any other day.
During my class, I felt a bit odd. I thought I had pulled a muscle in my back, and I was very concerned because I had so much to accomplish in that day. My jaw felt strange, my arms were going numb. I was dizzy and I was really sweaty. I knew something was wrong.
Women often do have different symptoms. It may be more of a sense of fatigue. It may be more a typical pain in their neck and in their back. Their symptoms are often a little bit trickier to tease out at the time of the presentation.
The ambulance was called to the Princeton Club and everything seemed to check out fine. It was decided it was best to be checked out at the hospital based on my symptoms. Suddenly, things took a turn. The EMTs discovered I was in full cardiac arrest and was quickly raced to the hospital.
I remember being in the ambulance, and then my next memory was being in recovery.
Jody's situation was, she came out of the health club, she felt poorly, she had atypical symptoms. She sought appropriate care. The electrocardiogram was abnormal. She was taken up to our cardiac catheterization laboratory where blockages were identified and her arteries were open.
I continue to eat right, exercise, and find balance in my life, spiritually and emotionally. I now know what to look for in friends and family if they present with these symptoms. I owe my life to St. Mary's and the EMTs that saved my life that day.
As board chair, I've seen firsthand how philanthropy makes a difference in the lives of patients like Jody. St. Mary's Foundation Board of Directors approved the funding for the cath lab that saved Jody's life. This is a great example of how your generous gifts allow the board to support priority initiatives at the hospital and care center. During this time of change and uncertainty, unrestricted giving is the best way to help. Please join me in support of St. Mary's healing mission by giving today. In this next story, former 3-term board member Paul Berge shares the meaningful why behind his giving and how St. Mary's healthcare heroes saved his life, not once, but twice during the pandemic.
I'm Paul Berge from Madison. I've been a lifelong friend of St. Mary's Hospital. My wife Mary and I were married for 52 years. Mary was a very, very enthusiastic woman, very active in the community, and unfortunately in 2003 she suffered a very serious stroke and was transferred to St. Mary's Hospital. She received excellent care. However, several years later, in a conversation with Frank Byrne, who was then president of St. Mary's Hospital, we determined that may have been some additional services that could be available to stroke patients, and perhaps an expanded facility here at St. Mary's would be a good idea. Well, Mary and I decided that we would provide a gift to the foundation, which provided some assistance in the establishment of the first stroke center of any hospital here in Madison. Several years after the stroke center was established, a very dear friend of ours had a very serious stroke. He was transferred, of course, to the newly established stroke center, and in the middle of the night he received a procedure that would not have been available prior to the certification and the expansion of the stroke center. It saved his life, and that was very, very gratifying to us. Then time moved on, and Mary continued until 2012, and she passed away. Obviously, we all miss her dearly. Our family decided that it would be an appropriate thing to establish an endowment in her name, not only to honor her, but also to help the Stroke Center moving forward. So we set up the Mary K. Berkey Endowment Fund, and with family and friends and personal contributions, have established this fund, and from this point forward, each year the earnings on the endowment will go towards the Stroke Center here at St. Mary's. The COVID pandemic came on and really self-isolated starting about the 10th of March. And I was really in pretty good health, I felt. And then around the 10th of June, I was experiencing some chest pains, some discomfort, and I ignored them, as I guess many people do, rather than paying attention to my body. But after about 2.5 or 3 days, the pain was so bad I couldn't stand it. I called 911 and was transferred to St. Mary's.
Paul, it had some warning symptoms for a couple of days. They were vague symptoms with fatigue, shortness of breath, and some vague chest discomfort. He had a decline in his energy and exercise tolerance, and ultimately the day he presented in the emergency room, the symptoms became more pronounced and persistent. So when he came to the emergency room, he had a rapid assessment, finding abnormalities on his EKG and his blood work. He was again taken up to our heart catheterization laboratory where through an angiogram we identified blocked arteries, and we put a balloon and a stent in, and we restored the blood flow to his heart muscle.
Well, right after the heart attack, I began cardiac rehab at St. Mary's. About 2 or 3 weeks into the program, one morning I was in the hospital at the cardiac rehab, and I just didn't feel right. And lo and behold, I was having a stroke. And so I was transferred from cardiac rehab over to ER and whisked up to the stroke center here at the hospital. So here I found myself in the stroke center that I was a part of establishing 10, 12 years before that. After my stay in the stroke center, I continued my cardiac rehab and continued to improve. I feel stronger every day as a result of that. Bottom line is that I'm very appreciative of the care that I've received from the medical staff, the doctors, the nurses, the volunteers, and everyone at St. Mary's. For that, I'm forever grateful.
Wow, wow, and wow. It's incredibly humbling to hear these stories of gratitude. I am humbled and grateful for our exceptional healthcare heroes at SSM Health, including our philanthropic heroes like Paul and his beloved wife, Mary. Their support of our mission makes the world a safer and better place for all, and I believe that. Please join them in giving and supporting the incredible work our healthcare heroes do every day. The COVID-19 pandemic presented us all with enormous challenges. Challenges that may have seemed insurmountable to most, but not here, not at SSM Health, and not at St. Mary's. Our providers, care teams, and essential workers work tirelessly together with a renewed strength and commitment to our mission and values, and to serve all who enter our doors. Let's take a few minutes to reflect on the difficult journey we've been through together. Together we rise.
to silence, retreating to our homes. But somewhere in the quiet, we know the danger grows. What will be tomorrow? What does the new day bring? Another case of sorrow, another tragic end. Quiet prayer inside the chaos, shield our faces to the squall. While the world looks on, it's up to us to answer to the call. And we rise, we fight, we hold. And we rise in faith, we know we are strong enough and brave enough to love in place of fear. 'Cause we are called to service, we stand together here, we rise. Our brothers and our sisters, our family and our friends, we hold them in our thoughts as we start leaning in. Hand in hand across the distance, weary bones and wounded hearts. Through the tears and trials and tragedies, we push on through it all. And we rise, we fight, we hold. And we rise in faith, we know we are strong enough and brave enough to love in place of fear. 'Cause we are called to service, we stand together here. And we rise, we fight, we hold. And we rise in faith, we know we are strong enough and brave enough to love in place of fear. 'Cause we are called to service, we stand together here, we rise.
In late July, both of my parents were hospitalized in South Carolina with advanced COVID-19. My father responded well to treatment, but my mom's health declined steadily, and after 8 days on a ventilator, we lost her life to COVID-19. I share my story because I've had a rare glimpse into the exhausting, complicated, and unpredictable nature of critical COVID care. care that includes unimaginable days, care that includes distraught family, calling for updates, looking for hope, care that includes holding the hands of our loved ones when we can't be in the room. These compassionate healthcare heroes have earned the title of hero. Let's take a closer look at all the heroes supporting COVID care here at St. Mary's.
In the face of a global pandemic, SSM Health St. Mary's Hospital acted quickly to care for our community. Serving those most in need during challenging times is at the core of our heritage of healing. Our founding sisters boldly and courageously provided care and support in times of disease and epidemic. When the COVID-19 pandemic arrived in Madison, the physicians, nurses, and staff at St. Mary's remained focused on our patients. COVID-19 didn't stop other health emergencies from happening. Our resolve, dedication, commitment to serving our community never wavered, and our community was there to support us in return. Thank you.
Your cards, messages, prayers, donated PPE, meals for our caregivers lifted all of our spirits. Our volunteer heroes sewed more than 18,000 cloth masks to keep our patients, visitors, and non-clinical staff safe. What a blessing our volunteers are. We miss you in this building. Many of you also provided generous financial support. Those gifts to our Emergency Response Fund were used to support iPads and compassion windows for St. Mary's Care Center residents to meet with families safely, specialized PPE to protect our frontline heroes, and financial grants for our employees across the region facing financial hardships as a result of the pandemic. Our healthcare heroes appreciate the support as they continue to go above and beyond day after day to care for our COVID-19 patients and ensure all patients are safe.
It was a little bit scary at first, heading into a room, being scared to breathe, not knowing how to treat these patients exactly right away. But I'm so proud of my team. We stepped up, we've learned about this virus as it goes. I think some of the hardest things that we've encountered, aside from the challenges involved with the virus itself, is dealing with the emotional aspect of the family and patient. A lot of our patients' families are obviously very involved in their families' lives a lot, and so we're trying to, without allowing the visitors to be at the bedside, we're trying to fill that role as well. There's a reason we're called caregivers. We care quite a bit, so that part comes naturally, but trying to replace a loved one is almost impossible to do. So there's a few ways that we've encountered this barrier and tried to overcome it together. A few of us have began putting our pictures of our faces on the outside of our PPE as a way to connect with our patients. There's many times that our patients just see eyeballs throughout the day, and we're in and out so quickly to try to minimize exposure. So that connection is so important. We write notes to our patients and to each other through the glass doors to offer support and rally for our patients when they really need it most. Families have been sending in flowers and pictures. We've been posting those up all around the walls and the rooms, putting framed pictures at the bedside so even when we turn our patients, they're visible no matter which position they're in. A few of our patients have arranged for family members to stand outside in the streets and in the sidewalks outside of our unit, and our patients that are on the mend and able to get out of the bed, we've been able to walk them over to the window so that they can see their family and wave to them. It's been really powerful to be a part of that connection. Working in the ICU, we don't often get a chance to discharge our patients home as of when they normally leave critical care, they're heading to a regular medical floor. We do have a little celebration amongst ourselves. When our patients leave the ICU, they continue to get care in a regular medical room floor. When they're ready to discharge, if the patients have been in the ICU, there's usually a courtesy call made to our staff. The way that we've honored these patients discharging is similar to the way that we honor our organ donors. It's called an honor walk. Anyone who's been involved in their care in any capacity lines the hall on their way out and gives applause. And so we've adopted this initiative for our COVID survivors as well, and it's been really powerful, I think, for the patients to see all the work that all the bodies and all the people that were there to support their healing. And it's also really powerful for us as staff, as we don't always get a win. So when we do, it's really powerful to see families reunited in the streets and to be a part of that. Through our COVID times, we had the pleasure of taking care of a patient named Ernesto. He is non-English speaking, so along with the barriers that we've encountered of all of our PPE and not having friends and family around, he also had a language barrier as well. He found himself in our ICU for many weeks, became very lonely, of course. There's only so much us as ICU nurses can provide at the bedside. So his family arranged to visit from the window, actually. The ICU is 5 floors up. So we decorated his window so it was obvious from the outside of the street, and he had a family gathering down below on the sidewalk. We actually surprised him with this. We told him it was just in his best benefit to catch some sunshine, and so we walked him over to the window, and he was brought to tears when he looked down and saw his family. He said, "Mi familia, mi familia," and he reached for his cell phone so that he could be talking to them as he was seeing them. It brought tears to all of our eyes, and it really encompasses what we're trying to do here, which is not only heal the body, but to heal the soul.
It is a true calling to provide direct patient care. We are grateful for you, Kyle, and the teams of providers and caregivers at St. Mary's who dedicate their lives to serving others in such a deeply personal way. Thank you. For everyone joining us today, please consider a gift to honor our healthcare heroes. If you'd like, you can name a specific department or individual as your healthcare hero, or you can honor someone you love with your gift. The foundation team is here to help you. Please don't hesitate to reach out.
We look forward to a day when we can all gather together safely here in the healing gardens of St. Mary's. Thank you for joining us today, and a special thanks to those who have already extended your support for St. Mary's. Your continued support is important. Philanthropy ensures that our providers, nurses, and caregivers have the very best equipment, technology, and resources to care for our community, our neighbors, our family, and our friends. Please join us in support. Thank you.